What is biomarker testing? Cancer biomarker testing goes by many names. Regardless of the name used, these tests can inform the diagnosis, prognosis, and treatment of a patient's cancer. Treatment can include targeted therapies which target biomarkers that drive cancer growth. In this video, we will provide an overview of biomarker testing that informs response to targeted therapy. These tests assess different types of biomarkers which include DNA, RNA, and proteins. The process of biomarker testing includes identifying patients appropriate for testing, determining the best test for the clinical goals, interpreting results, and applying results to treatment decisions and management. Not all patients benefit from biomarker testing for targeted therapy. For example, it may not be indicated for patients who have many standard of care therapy options available, but it is indicated for patients with cancer that is aggressive, advanced, or metastatic. There isn't one test that fits all patients. Not all tests include the same biomarkers, use the same testing methods, or the same sample type. That's why it's important to know each test's capabilities and limitations. Understanding what biomarker test results mean for a patient can be challenging. The same result can be reported differently depending on the laboratory's approach. Because tests vary, if a biomarker doesn't appear on a report, it may simply mean that the test wasn't designed to find it. For example, most biomarker tests can detect small changes in DNA, but are not designed to detect large deletions. In addition, testing for some biomarkers, such as proteins that predict response to immunotherapy, has to be ordered separately. Reports show which therapy can target each biomarker. They provide information about targeted therapies that are FDA approved in the patient's cancer type, FDA approved in a different cancer type, and biomarkers that are being studied in clinical trials. The level of evidence associated with each treatment option may differ depending on the available clinical data. Weighing all of the information in a report can be challenging. Molecular tumor boards can provide an informed assessment and help prioritize the different treatment options. These multidisciplinary boards typically discuss how the biomarkers detected are likely to impact the patient's cancer and the advantages and disadvantages of potential therapeutics. Reports from biomarker tests are rich in data that can help inform treatment options. Knowing what information is available and how to interpret it is an important first step.